Hi, I'm Dr. Jack West, and I'm a medical oncologist with a focus in lung cancer at the City of Hope Comprehensive Cancer Center in the Los Angeles area. I'm also the founder and serve as president of Global Resource for Advancing Cancer Education. And this is another one of our series on COVID and cancer. I'm very happy to be joined today by Dr. Benjamin Levy and Dr. Jared Weiss. So let me turn it over. I'll have Dr. Levy introduce himself.
I'm Dr. Benjamin Levy, and I'm Associate Professor at Johns Hopkins School of Medicine and the Clinical Director for the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial in Washington, D.C.
And Dr. Jared Weiss.
I'm Jared Weiss. I'm a medical oncologist specialized in thoracic, Associate Professor of Medicine at UNC, Section Chief of Thoracic Oncology there, and Vice President of GRACE.
Let's continue. Fortunately, we're in a different situation than several of the prior times that we have connected to talk about the status of COVID and cancer when it's been much more acute. We have had vaccines for just about a little longer than 6 months, and they work. And it's not as if there's no risk of COVID anymore in the US or especially other parts of the world at this point, entering into the summer months. But the magnitude of it and the shutdown of our lives has really turned around. But there's still variable acceptance of the vaccines. Some of that is geographic and just political and philosophical. And we're in different parts of the country. And I'm really interested in what things are like where you all are, and in terms of acceptance of the vaccine and how that has translated to opening things up in your respective communities. I'll start by saying that, I'm in Los Angeles. It has been, much of California has been the tip of the spear in terms of eagerness or acceptance of the vaccine, which is good because it's also an area that's been particularly hard hit. Maybe because of both of those factors, we have had a much lower acuity in the last several months, seemingly because many of the people who were candidates for vaccines have gotten them. Most adults who have been able to have pursued that, although there's still pockets, particularly around Orange County, where people are fighting vigorously to defend against that. But then a lot of people have already had COVID. But between those factors, the numbers have gone down, and we are not dealing with issues of worry of capacity in hospitals anytime like we were in much of 2020. So maybe I could turn over to Ben and get a sense of where things are in the mid-Atlantic around the Baltimore area.
Yeah, so DC, Baltimore area, I think is fairly close in terms of at least my perception of patients' willingness to receive vaccine, fairly close to your Los Angeles experience. I think by and large, our patients in this area, I think, has been very receptive to vaccinations. And I can tell you that most of my patients have been vaccinated with both doses of vaccine. We have some pockets of patients perhaps that were less receptive. I think when this all rolled out, there were a lot of questions about timing of vaccine that it relates to chemotherapy or immunotherapy. Does that do anything to the effectiveness of the vaccine? I think we made a push at Hopkins, given our health system is across both Baltimore and DC, to really say, look, we don't know what the timing should be and when you are should. So I think that message has resonated with the population here. I mean, you look even at the 7-day average in DC right now is down to 9 cases. It was pretty remarkable. That's indicative of how quickly the DC area at least has been receptive to this. And this in turn has changed, when your averages are that low, it allows us to open up our practice a little bit more. So just 2 weeks ago, we allowed a care provider to come with the patients. That was a no-no for over a year. But starting just in early June, we were allowing now 1 care provider for every visit to come with them. So I think the patient's willingness to accept this, to hop on it, to get it done, has translated into lower rates, which has translated into us being able to be more flexible with what we do in our health system.
That's great. Jared, what are things like there? I'm also definitely interested in, the questions, the practice of allowing visitors back in, because and that's one of the things that's fallen a bit behind, that we still have not gotten back to at City of Hope, in part because we have so many patients getting transplants and hematologic malignancies. So there's a very high level of vigilance about that, maybe arguably overcautious.
So North Carolina is a very heterogeneous state across almost any variable that you might choose to talk about. As a state as a whole, we are far behind the national average in COVID vaccination. But it's interesting, if you look on a county by county basis, in some counties, there's an experience more like what you're describing in California, where the majority of eligible patients, or people, I should say, are vaccinated. And then if you look at others, you would think that vaccination weren't being offered. And in fact, in listening to patients, that heterogeneity is very obvious. Certainly, by definition, all of us are treating cancer patients. So cancer patients are more afraid for their health. They have more contact with healthcare providers. They're more likely to be vaccinated, and that remains true in North Carolina. But as state as a whole, there's dramatic differences in vaccination rates, dramatic differences in daily COVID rates. So I happen to be here in Orange County, North Carolina, and we've had days without a reported COVID case. And we've had days where our COVID ICU has not had a patient in it, which is remarkable because at the peak we had 3 full COVID ICUs. So as a global point, we're doing a whole lot better, but the heterogeneity point may outweigh anything here. There's still major barriers. There are still all kinds of misperceptions and fears about the vaccine that I'm hearing from patients and their families. And one dominant theme is this vague fear. So, if you look at the news media, there's talk about people who are like afraid there's some kind of tracer in there. I don't know, these people have iPhones and they're worried about tracer in the vaccine. But at any rate, I'm not hearing that. What I'm hearing from people is this vague, I don't know, maybe one day it could have some problem, not a specific thing, like I'm afraid it's going to give my kid autism, or there's a tracer in there, or one discrete thing. I find this very ironic because as we learn more about the high proportion of people who are long haulers and what happens to them, I'm actually much more worried, and say my unvaccinated children, about these pleiotropic and long-lasting and vague long-term harms from virus. But this vague fear is still something I'm very much hearing here in North Carolina.
Well, that's interesting because I just think it reflects a general distrust of the big authority, whether that is government or medicine or whatever. It's just, the system is not operating in our best interest kind of way. So.